We know that opioid-related incidents in the emergency department and accidental overdoses are definitely on the rise.
Last year, Windsor Regional saw 573 emergency visits specifically involving fentanyl, including 346 overdoses.
Windsor Police and Windsor Regional Hospital are teaming up to meet the community's mental health and addictions needs.
Officers are being paired with nurses. The frontline workers are coming together in a 3-month pilot program. The head of Windsor Regional Hospital says their staff and police are the only ones available.
Right now, we're the two that deal with this on a daily basis and deal with it in real time.
The NPT program's goal is to deliver immediate care and connect individuals in need with the appropriate support services.
Like many communities across North America, we've been experiencing elevated levels of social disorder, which includes homelessness, addiction, and displaced persons. And as a result, we wanted to seek out a proactive relationship with Windsor Regional Hospital. And through the conversation with them, we were able to develop the nurse police team. So what we've been able to do is really respond in a more enhanced way to deal with the social disorder issues that we have downtown.
So we've listened to what the community needs, and we've heard what they want as well, right? So there's been an increased amount of long wait times in the emergency for people seeking, mental health, or it could be as simple as a dressing change. So that's helped quite a lot, actually, in the time span that they're able to see somebody right away and have a focused, centered patient care and be able to, establish a care plan right there in that moment.
Being out with Windsor Police and the NPT team, I come in, I get my equipment ready. They provided me with safe equipment, which is always firsthand. Radio, earpiece. We get our medications ready that we need, and then we meet up with the police officer that will be for the rest of my shift.
Typical shift as a nurse police team member would essentially arrive at the hospital, pick up my partner for the day. It's nice because we do have usually the same nurses that we're working with, so we can build rapport with one another and have an opportunity to work more efficient.
Charlie 33, if you can respond to a disorderly call, it's just going to be across the street from the mission, 875 Olette. 875 Olette. The staff is calling from there. They're witnessing 2 males in the bus stop across the street. They appear to be doing some drugs. We're working on a description. If you can start that way. Your timeout's 15:27.
Charlie 33, 10-4. We usually see what calls for services we can attend to be able to support, those calls in the community that are already waiting that may be in our mandate to go to. If there's other officers that can also attend with us, that's even better.
We do rounds in different parts of the city where we know that a lot of the patients go. So the plan is to go to the mission first today, Jake?
Yeah, we're going to head to the mission, speak to some people.
Okay.
So we're approaching the mission now.
We are.
Let's
see how busy it is.
They've put this new fence up.
Yeah.
Charlie 33.
Clive.
Can you show us on the NPT downtown mission pop file, please?
Tempered.
So wait for them to send us the call. Here we are. So what we'll do, keep this running. You have a set of keys.
Mm-hmm.
So if you need to go back to the car for whatever, we'll just start out having some conversations with some people. All right?
All right, Roger.
The NPT program has made a huge impact at the downtown mission. We've seen our clients get access to services in a way that they weren't before. And we also see them treated differently. Their team has put an emphasis on getting to know our population, and because of that, there's a camaraderie, there's a relationship aspect to it, and there's a trust that my clients put in their team that goes above and beyond what they put in just a cruiser or just the WPD by themselves.
There's an individual in the community that I had dealt with in the past, and that experience with him, I think left him with a sour taste in his mouth because I had to do my job in the moment. However, there was a time shortly after that when this pilot project first started where I'd interact with him again in a different part of the community, and he remembered me, but he was, again, his interest was piqued on why I was working with the nurse. And I find that the conversation that I had was completely different with this individual.
You build a rapport with the patient. It's nice because you're in their environment as well. So kind of, it takes the stress levels down. They're more willing to engage. They're more willing to communicate with you.
You can really see that they're starting to trust the police more and coming to us for resources and assistance because they know that we have that resource for them, or they know that we have something to offer them, and it's not always them getting in trouble. It's here reaching out for a friendly hand. And I think that it's really helped us create a really good friendly face and a good bond within our community, because we don't always get to see the finish line. We don't always get to see if our resources are helping someone. So it was nice to be able to offer someone the help that they were looking for and seeking, and truly seeing a benefit come from them and getting them on the right path.
The NPT team has been able to divert almost 44% of people that they come in contact with from going to the emergency department inappropriately, because their needs can be met on the street and with the care and with the response that is most appropriate for what they need at that time.
If we conclude that a patient does need to come in, we have the dispatch cell phone that we can get into contact with our charge nurses right away.
Hi, Charge. It's Yemi with the MPT. Just letting you know, we are bringing in a roughly 55-year-old male with the MPT team, ETA about 5.
And during that time, they would alert your staff as well, and crisis code would be called.
Can I have crisis response to emergency, please?
Attention staff, crisis response team emergency. Attention staff, crisis response team emergency.
It allows for the patient to receive, a mental health nurse right away, management to be involved.
Having a mental health social worker down in the department like myself can definitely help de-escalate the whole scenario. Having that DBT training and other type of training and certifications that we have, we can help kind of talk the patient through the type of crisis they might be having, and just to kind of ensure that they're getting the best support as possible.
We also have another officer that's stationary here basically 24/7, and they have an important role as well. So a crisis code gets called, the patient is brought in. At that moment, you see our Windsor Regional Officer come in, and they establish a report from the receiving officer that's bringing the patient in. And at that time, handoff is given, and he's able to watch multiple patients as well. And if there's a need where we think, the patient needs a little bit more, security, just to, for his safety and staff safety, we also would bring our safety guards as well. It also takes away that extra need for the police officer to be with the patient at all times. So it puts the officer back on the road to be able to assist the community as well.
There's been a lot of great outcomes that have come from this team. We've been able to help a lot of individuals that probably wouldn't have been able to get the same help if this team wasn't around. At this point, we've seen about 490 patients. We have diverted about 170 patients from coming to the emergency room. We've handed out over 60 different naloxone kits, and we've been able to respond to providing patients to primary care that they wouldn't be able to get. That's not a real stat that we're able to look at, but I think that's probably one of the most important ones.
It's been an amazing experience. What I mean by that, it's built and made relationships stronger with Windsor policing, which we've never seen that before in our community, to be that close together, to be able to, establish care for a patient, to be able to assist each other on calls.
The NPT team is really allowing social service agencies and municipalities to come together with police teams, and most importantly with healthcare, to make sure that healthcare is accessible to our neighbors experiencing homelessness, because they deserve better.